Hello and welcome to the Care Forward webinar. I'm Colleen Ferris, Director of Innovations and Strategic Development at Healthcare Excellence Canada. I'm pleased to be one of your co-hosts today alongside my colleague, Neil Dreimer, Director of Health Innovation Programs. Before we get started, I'm going to go through some of the technical components to ensure all of you joining us from across the country have what you need online for a positive experience. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation provided by Karine Rosbach Communications Incorporated for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you do not see the interpretation menu on your screen, please select the More menu and select Interpretation. We invite you to share your questions and comments at any point using our chat box in either English or French. And we encourage all of you to respond to comments and answer questions in the chat as you wish as we go along. Knowing that today's session, we may not get to all the questions and answers for the upcoming offerings, do know we do have focused Q&A sessions coming up. If you need support at any time during this webinar, you can reach out to tech support Soutien Technique using the direct chat feature. Now, I'd like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from Ottawa, where I am located, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. We invite you to introduce yourself in the chat and let us know the lands you are joining from today. And thank you to our HEC colleagues in the background who are adding the native land website in the chat if you'd like to learn more about the territory you are joining from. As mentioned, Neil and I are going to be your co-hosts for the next hour, and we're thrilled to also be joined by Bill Callery, Megan Sabian, Jennifer Major, and Sarah Olver, who are all senior program leads at Healthcare Excellence Canada, and we look forward to hearing more from them later on in the webinar. During today's session, you'll hear about HEC's just launched Pan-Canadian movement to improve care for more people and how you can take part in our new offerings that are focused on 4 key priorities. These 4 key priority targets are directly delivering on HEC's strategic plan and incorporating HEC's ways of working, including our quality and safety perspectives, which are lived experience of patients, caregivers, and communities, people in the workforce, value, cultural safety, and equitable care, First Nations, Inuit, and Métis priorities. So imagine a future where everyone receives the right care at the right time and in the right place, where more people can access primary care and not feel that the emergency room is the place they need to go, because they can access care elsewhere. Think about aging at home with dignity and long-term care that is compassionate and tailored to those who need it, and where the health workforce is supported and leading the way forward. That's why we're inviting you to join Care Forward, a pan-Canadian movement of people making healthcare better, faster by sharing knowledge and applying proven approaches for high quality and safe care. With support from HEC and supporting organizations, and through funding, resources, expert coaching, and peer networking, healthcare changemakers like you can drive lasting local impact and improve care for at least 1 million people across the country in 4 key priority areas: expanding access to care and easing pressure on emergency departments, helping more people to age where they call home, advancing safe, person-centered long-term care, and supporting the workforce. And this would not be possible, so a big thank you to our 24 supporting organizations that are joining part of this pan-Canadian movement towards driving change across the country and committing to common healthcare goals. I'll now turn it over to my co-host, Neil. Over to you, Neil.
Thanks so much, Colleen. So you might be asking yourself, how can I and my organization be part of this movement and take action? Well, the good news is no matter your role, capacity, or starting point, there's a place for everyone in this work. We already have an open opportunity that is helping more people age where they call home and advancing safe, person-centered long-term care. If you haven't yet, it's not too late to join the Sparking Change in the Appropriate Use of Antipsychotics program to take the next step in advancing person-centered care through more appropriate antipsychotic use and have an opportunity to win financial awards along the way. Or you can learn more about Nursing Home Without Walls to help older adults age in place with nursing home level support in their own homes. With Care Forward, there's something to meet your team where you are. So in addition to sparking change in Nursing Home Without Walls, we're really excited to share our 4 new offerings that all move toward expanding care to improve access and ease pressure on emergency departments. To allow us to achieve this, HEC has recently enabled new technologies and acknowledged that we will continue to refine these systems throughout this launch and beyond. So these 4 new offerings are guided by 4 key policy pathways to help reduce avoidable emergency department visits, which you can see on the slide here. Supporting community-based health promotion and disease prevention, expanding access to primary care, enhancing appropriate care through service integration and innovation models, and finally, strengthening the healthcare workforce. Our goal is to expand care options for people, but not to discourage them from seeking help when and where they need it. If your organization is innovating in primary and community care, and your outcomes have the potential to expand care to improve access and ease pressure on the emergency department, there are 4 offerings for you. Your organization can choose which offering best fits your work structure and readiness. You can even join more than one. Along the way, you'll also have the opportunity to build skills in equity, cultural safety, patient engagement and safety, and other areas such as quality improvement and working in partnership with First Nations, Inuit, and Métis communities. So with that, I'm now going to turn it over to my colleagues who will provide a brief overview of each new offering. I'll first invite Megan to join us and talk more about the Right Care Challenge offering. Meg, over to you.
Wonderful. Thanks, Colleen, and thanks, Neil. As Neil mentioned, the Right Care Challenge is the first of the 4 offerings we're inviting you to join. The Right Care Challenge is an offering that is 12 months in duration and offers resources and awards to teams who are launching or enhancing solutions to expand access to care and reduce pressure on emergency departments, rewarding their success and sharing the learnings with others who could apply them too. We welcome health and social organizations at all stages of their quality improvement journey to join, including those that have recently identified a need, those that have conceptualized a solution, or those that have already initiated implementation. Registration into the challenge is done in a few simple steps, though the earlier teams join, the more opportunities they'll have. Once enrolled, participation is flexible and low effort, where teams can avail of award and team support opportunities that best fit their needs. Participants will have a chance to win monetary awards, recognizing their work to expand care and reduce avoidable emergency department visits in 4 key areas. This includes community health promotion, including initiatives that prevent diseases and promote health right where people live. Workforce transformation efforts, including those that expand scopes of practice, reduce administrative burden, and improve licensing pathways. Expanded primary care access through team-based models, optimized scheduling practices, and more. And finally, integrated and innovative models such as virtual care and connected medicine that better connect primary, urgent, and emergency care. Throughout the challenge, there's over $900,000 in prizes available to participating teams, whereby a single team could win as much as $34,250 if they're successful across all award opportunities. We're also pleased to partner with the Graham Beck Foundation, who will provide support to integrated youth service teams with a GBF award. There's 5 awards available of $10,000. Participating teams will have access to virtual learning, coaching, and networking activities to help advance unique healthcare improvement initiatives to ensure patients receive the right care at the right time and in the right place. In the most recent Health Workforce Innovation Challenge HEC hosted in 2023 to 2024, we supported nearly 150 healthcare teams across a variety of settings, taking steps to retain and support their staff. Nearly 3/4 of reporting teams achieved impacts such as improved retention, work-life balance, and improved patient care. For example, one team introduced a voluntary compressed work week that led to a 30% jump in work-life balance ratings in less than 3 months. One of the teams shared this quote with HEC. Our mission was to truly understand our staff's needs before proposing solutions. We found that recognition and greater visibility from leadership was the top concern. We engaged with the challenge at every level. This included board, senior leadership, and frontline staff. And this led to a 70% drop in our vacancy rate and a significant improvement in retention. So with that, the Right Care Challenge offering will offer support to you to advance your unique goals for your improvement, while also sharing and learning with other communities and organizations from across Canada. If you're interested in the Right Care Challenge, registration is now open until October 31st, 2025, with award opportunities starting as early as June. You can find all additional details on our website, and we encourage you to join the Q&A session on May 21st to learn more. The links can be found here in the chat. I'll now turn it over to my colleague Jen, who's going to join us to talk about the Primary Care Access Improvement Offering.
Thanks, Megan, and hello, everyone. So Primary Care Access Improvement is an 18-month offering that will support 25 team-based primary care organizations to implement contemporary advanced access. Advanced access is a widely endorsed quality improvement model that enables patients to access primary care services when they need it while ensuring continuity of care. It achieves this by creating efficiencies and optimizing team functioning in primary care settings. Expected outcomes for teams include improved timely access to care for patients while ensuring continuity. This improvement in access can help ensure that patients can get care in the right place at the right time with their usual team of primary care providers and helping them to avoid unnecessary emergency department visits. It also will hopefully improve provider work satisfaction and team collaboration. The offering is based on work that's being led by Isabel Gabbery and Milan Breton and others from the University of Sherbrooke. And the offering is based on the increasing efficiency to improve access to care learning collaborative that the Alliance for Healthier Communities in Ontario hosted recently. So with the support of dedicated coaches, teams will apply 5 pillars of contemporary advanced access. Each pillar identifies an area of work necessary for successful implementation of advanced access. For example, one of the 5 pillars focuses on helping healthcare teams to balance appointment availability with patient demand or request for appointments so that patients can get that timely access to appointments without long wait times. With an assigned coach, teams will also create an improvement charter to describe the challenges they're experiencing with access and to identify the opportunities that they see for improvement. So based on the unique challenges and opportunities that the improvement team identifies, teams will work with that coach to develop aim statements, establish measures, and test change ideas through plan, do, study, act cycles, and always a look at the data. The coaches will support teams to implement and sustain change ideas that ultimately improve access for patients, as well as the experience for providers. So as I've mentioned, advanced access has been shown to reduce wait times for appointments, improve patient experience, lighten workloads for primary care teams, and improve job satisfaction among administrative staff and the health workforce of that primary care setting. So by joining primary care access improvement, teams can receive up to $15,000 in seed funding, as well as have that dedicated coach support that I've described. With support from a coach and HEC, teams will be supported to implement advanced access within their unique settings, given their unique challenges and opportunities, while also sharing and learning with other primary care providers and organizations from across Canada who are also participating in the offering. Virtual and in-person learning to foster peer connection and learning will happen bi-monthly, and there's going to be monthly coaching and 5 pre-scheduled webinars that all teams across the offering will take part in. This offering is for your organization if your primary care clinic or organization delivers team-based primary care, and if your organization has a challenge with access, whereby patients cannot see a member of their care team in a timely fashion. The offering does involve a high level of effort. So for example, teams will commit to collecting and sharing data to guide improvement, including a measure of patient wait time called third next available appointment that will be measured on a weekly basis for all or most of the providers in the organization. Also, an improvement team that includes an executive sponsor, a team lead, and a measurement lead will meet several times a month with an assigned coach. Teams will work with that coach to plan, test, and evaluate those organizational changes that are required to embed advanced access. And the coaching sessions will sometimes bring in other members of the broader primary care setting or organization, such as physicians, nurse practitioners, and administrative staff, to guide the implementation and come up with change ideas to test so that the organizational commitment will really set the teams up for success. So as one example of successful implementation of advanced access using this coaching support model that primary care access improvement offering will involve, after just 6 months of implementing contemporary advanced access with support from Healthcare Excellence Canada, Isabelle Gabbery, Milan Breton, and team based out of University of Sherbrooke supported 4 clinics in Quebec to achieve the following results. Improved access to team-based primary care with appointment wait times reduced by an average of 7 days, more appointment availability within 48 hours, and better provider experience with providers sharing that they had reduced workloads, fewer administrative tasks, and higher job satisfaction. So applications are now open until June 27th, 2025. If you're interested in registering, you can find all the additional details on our website, and we encourage you to join the Q&A session on May 29th to learn more. So next up, I am going to invite my colleague Bill to join us and talk more about another offering called Enhancing Integrated Care.
Thanks so much, Jen. So hi, everyone. Enhancing Integrated Care is a 12-month offering that will bring together up to 100 primary and community care organizations to collaborate, share knowledge, and implement evidence-informed and team-based promising practices, including virtual care models that improve access to care and reduce pressure on emergency departments. And you may be wondering what we mean by team-based integrated care. We're really referring to collaborative approaches where different healthcare providers work together as a team with patients and caregivers to provide coordinated, patient-centered care, ensuring patients receive the right care at the right time. So for example, teams may include primary care providers, specialists, allied health professionals, community and social workers, pharmacists, and mental health professionals, just to name a few. If you're working in team-based integrated care and primary care settings, such as clinics, hospitals, home care, mental health, and long-term care, this offering is for you. Next slide, please. By participating in enhancing integrated care, your team can receive up to $10,000 in seed funding, access to coaching sessions and advice from experts, virtual learning and networking opportunities, and measurement and evaluation support. This offering builds on the success of recent HEC initiatives, including, for example, our work on hospital to home transitions, providing appropriate virtual care, and health workforce retention. A recent program participant told us that by participating, they built new relationships and were able to significantly expand the availability of addictions medicine consultations for their clients. And we're excited to see many more successes like these from teams participating in enhancing integrated care. Applications are open until June 19th, so encourage you to apply now. And we will be hosting a questions and discussion session in collaboration with the Right Care Challenge on May 21st. So we encourage you to register if you haven't already and join with your questions and to learn more. And we've posted the link to register in the chat. So now I'll invite my colleague Sarah Ulver to give an overview of the paramedics and social prescribing offering.
Thanks, Bill, and hello, everyone. Paramedics and Social Prescribing, or PASP, is a new 18-month offering to support paramedic services to improve, further embed, and systematize social prescribing in their service models. The goal of this offering is to provide space for teams to focus on optimizing social prescribing within their service by bringing people together to share knowledge and experiences. So, what is social prescribing? Social prescribing helps people by connecting them with support and services in their community to address non-medical needs that affect their health and well-being. It involves healthcare workers and community members working together with the participant, supporting them co-create a plan to improve their own health and connect them with others. This can be a connection to a food bank, a senior center, a class, a recreational activity, legal supports, or many, many more. And why paramedics? Well, many paramedics across the country are already supporting people through social prescribing, but calling it different things like system navigation. They're really well positioned to support social prescribing because they meet people where they live and in their communities. And because of this, they have a very, very unique view of what services could better support the person's overall health and well-being, beyond just the great medical care that they provide. There are some stellar examples of community paramedics already doing this in Canada. We encourage you to check out our Promising Practice Guide, which we'll link in the chat just now. These will show you what other services across Canada are doing, so you can test it in your own system, and as you work to standardize your social prescribing approach. The guide breaks social prescribing into 3 basic steps with examples in each. At a high level, the 3 steps are to identify, collaborate, and connect. The first step, for example, is to identify that a person has health-related social needs. And in this section, we introduce promising practices from services that use structured assessment tools, remote monitoring, proactive identification of social needs, and different methods of building trust. The examples range from the community paramedicine program at BC Emergency Health Services changing their uniforms to build trust, to 27 paramedic services across Canada using a standardized assessment tool developed by McMaster's University CP at Clinic program. This tool examines health history, financial security, and mental health support using a validated health risk assessment that looks at things like heart disease, risk of heart disease, diabetes, fall, as well as quality of life, social isolation, and poverty. We welcome services to apply to join PASP regardless of where they are in their journey, from those just starting social prescribing or those improving a segment of their well-established service. In joining PASP, we will help you understand and action each step of the steps highlighted in the Promising Practice Guide, and we'll share tools and resources along the way. This is a higher intensity offering, and selected teams will receive up to $30,000 in seed funding, group coaching calls, and monthly virtual learning experiences that will foster peer connection and knowledge development. We'll also have an in-person learning event in November, and HEC will support costs associated with the team lead attending that in-person event. Applications are now open until June 27th of this year, and if you're interested in registering, you can find all the additional details on our website. I really encourage you to join the PASP Q&A session on May 22nd to learn more. Until then, that's all for PASP. Thanks, everyone, and back to you, Colleen.
Thank you so much, Sarah, and I will bring up also my co-host Neil, and thank you, Bill, Jennifer, Megan, for sharing with us the upcoming offerings that are launched as of yesterday as part of the priority area of expanding access to care and easing pressures on emergency departments. We have received some questions in the chat. And so just we'll work to acknowledge and also encourage other ones to keep on coming in, while also highlighting for these offerings that Megan, Bill, Jennifer, and Sarah have just walked us through. There will be dedicated, more detailed webinars over the next 2 weeks about those and more detailed Q&A sessions for those. So there was some questions about what's the right care challenge and in a competition format. So the challenge offering is really about offering teams that flexible and light touch. And I think from demonstrating across the 4 offerings that we've shown here today, a real suite from more high touch, intensive offerings to lighter touch to really be flexible and meet teams where they're at, all towards the goal of implementing and sustaining change ideas. And so we've seen across other challenges that we've held, and Megan shared some highlights there, that a majority of teams that were joining the challenges already had an initiative underway or ideas that were, as some folks even shared with us, kind of sitting on the side of their desk already, and where really the challenge model served as a catalyst for getting their work underway. In addition, the challenge offers no limit on the number of teams that can participate. While not all teams may be successful across monetary prizes, everyone can avail themselves of the coaching and resource supports, which are what many teams have said to us is provides the most value add across previous challenges that they've participated in. So encouraged to learn more about the Right Care Challenge as well as all of these other offerings. Also, I did see a question about where do certain health teams fit in. And so just want to flag these, we think of the health workforce in a very broad sense, and that so do look at these offerings and to see how your health team could join any of these or put an application forward. Neil, anyone's you're seeing on your side?
Yeah, no, thanks, Colleen. And I see the questions are starting to flow in now, so please continue. We'll do our best. And if not, we'll go to encourage you to also attend those specific Q&As over the next few weeks. But there was a question here, has there been any consideration on the inclusion of social prescribing, considering a patient and caregiver's social determinants of health on their health outcomes? So great question, and wasn't sure from the question if it's related to a specific offering, but what I can say is that specifically for the paramedics and social prescribing offering, we are excited to, that offering, as Sarah had just mentioned, is really going to focus on helping paramedics work with community agencies and the people that they're connecting with in the communities to really look beyond just medical needs, but also considering their social needs through a social prescribing approach. And I believe there's probably elements of social prescribing as well in Nursing Home Without Walls, and there might be other opportunities depending on the offering. But absolutely, we know from so much work that there's the determinants of health go beyond just medical needs. So we're making sure to build that into the different offerings for sure. And there's definitely some resources that I think we included in the chat that talks a little bit more about some of our offerings and particularly around paramedics and social prescribing. There's a new promising practices guide. Colleen, what are you seeing? Anything that you want to raise?
Yes, seeing lots of activity, and I just want to highlight, I see a question coming in about the differences about the enhancing integrated care and the primary care access improvement offering. Can they be interconnected? So the interconnected part, maybe I'm going to speak to the second part, because I want to kind of tie in another question that keeps on coming up about, can I be part of more than one offering? But just want to highlight that the enhancing integrated care is a very broad, it's a lighter touch offering, and it's not a set proven innovation and practice that teams will need to follow as part of the implementation. So if teams are thinking or already doing work towards enhancing integrated care, that enhancing integrated care is a great opportunity to put forward an application. As to that primary care access improvement, this offering is very much following the design and the implementation of that contemporary advanced access approach that is being modeled off by the team of Mylène Breton, Isabelle Gabory at the Université Sherbrooke, as well as work that's been done by the Alliance for Healthier Communities in Ontario. So the primary care access improvements is a very set process that folks need to follow, and it's for team-based primary care clinics only. The enhancing integrated care is open to a lot of different settings as well. And so just wanted to highlight the differences. Now, as to the interconnected, or maybe more to speak about, what if my organization wants to apply to more than one offering? Is that possible? Or what if I'm already part of the Sparking Change and I want to apply to another one? Yes, absolutely. An organization and or a team may apply and participate in multiple HEC offerings. If a team submits, though, just to highlight, if a team submits to more than one offering, not including the Right Care Challenge, the improvement project for each team must be different. And this is connected to some of the data elements that teams will be asked to submit. So again, slight exception for the challenge offering. Back over to you, Neil, for things you're seeing.
Yeah, no, continue to get lots of questions. So I think one of the more general questions was, and where did I see it? Oh yeah, there's a couple of similar questions around is it only institutional based teams who can participate in the offerings? Any opportunities for nonprofit organizations that work in community? So the answer is yes, absolutely. I think I might be mistaken. I think the primary care access improvement one is different, but I think for all the other offerings, there is opportunity for more community-based nonprofit organizations to either participate or be part of a team. I know for the paramedics and social prescribing offering, for example, we encourage paramedic services to apply as a broader team with a community-based organization. So there's opportunities there. And like Colleen just mentioned, there's lots of opportunities related to enhancing integrated care and the Right Care Challenge, those different offerings to, you don't have to be institutionally based. And there's definitely more details on our website with all the different parameters around who can participate, but generally speaking, it's a very broad opportunity. And Colleen, are you ready to answer another one?
Absolutely. And I know it got highlighted in the chat, and appreciate the team HEC that's also responding to many of the questions in the chat. But just to highlight, we will also be sending out information after this webinar, which will include the recording, but also really as well as links to the Care Forward site on the HEC website, as well as links to these specific offerings. So you can look at those in more details along with your team in order to consider which ones might be of interest to you. One thing I'll also is how do teams assess and report progress? So typically the offering will provide instructions and guidance, and this can be found in the central call for application for these 4 offerings, which we will make sure that's connected in the message that goes out to all participants, as well as guidance is also given through coaching as well as through HEC supports on how to assess progress in the improvement initiative. It will be slightly different for each offering, but so please do look at the call for applications as well as other details about the offerings as well. And we have an FAQ online about the evaluation goals for these offerings. I'm seeing 5 come in. I haven't scrolled down yet, Neil, so maybe I'll pass over to you in case there's something I missed.
Okay, so another question we have, and I imagine this is regarding the paramedics and social prescribing offering. As far as I understand, paramedics are first responders who take people to hospital. Do different provinces have different definitions of the term paramedics? So yes, the scope of work is different in each province and territory. So there are what we understand to be 911 or emergency responder paramedics. And then in some provinces and territories, that there is also community paramedic services. So the paramedics and social prescribing program, where community paramedics exist, that they might be better suited to participate and apply to this offering. But we know that not every province actually has community paramedic services. So we would welcome more urgent care 911 paramedics to also consider it where community paramedics don't exist. Community paramedic services provide fulsome care during their visit with the participant, and that can include medical and social support and transportation to the emergency department when needed, rather than only transporting them to emergency departments. So the scope is a bit different, but there's different types of paramedics, and it will vary based on each province and territory. Colleen, you ready for another one?
Absolutely. I saw a question, I believe it was around, what about a community of practice? And yes, absolutely. So while we see these 4 offerings are looking to address those pathways that Neil shared earlier on as it relates to expanding access to care in order to ease pressures on emergency departments, we also know there's a lot of important opportunities to learn from others that are in the same area, maybe not necessarily doing the same thing. So throughout this team HEC, as has been doing in other programs, will continue to explore opportunities for inter-offering learnings and sharings and bringing teams together. So while we don't have all the specifics, do note that is certainly something that we continue to do and will be exploring as this work goes on. And I would also say we would continue to explore it outside of just those that are within the expanding access to care and easing pressures, connected to the other priority areas that we've highlighted as well, and the offerings there, Sparking Change and Nursing Home Without Walls. The one thing I wanted to highlight, there was some questions about promising practices, about what some emerging best practices. And so I would highlight actually on the HEC website and on actually, I think especially the Enhancing Integrated Care, on the page where we have more details on that, we have actually a list of highlighted promising practices, both from historical HEC programs and teams that have been doing great work about really connecting health and community and the social aspects, as well as recent promising practices that have been just come out. I think it was in March, for results of the strengthening primary care in northern rural remote, where all the focus was on improving access to safe, specifically culturally safe care. Neil, anything coming in on your end?
And tell me, because I've been reading some of the comments, so I might have missed this. Did you answer this one already, Colleen? If not, I can. Does the offering, and I think this is for enhancing integrated care, does the enhancing integrated care offering look similar to the models of care in Ontario, including the Ontario health teams, including primary care and long-term care? Did you answer that one?
You know what? Great flag, Neil. I saw that one and I totally missed it. So thank you. And maybe just highlight that, I'll just highlight that many practices are already in place, such as the Ontario health teams, but also across this entire country that would be eligible for many of these offerings. And thinking of that enhancing integrated care, that right care challenge. So we really encourage you to look at the specific eligibility for each of the offerings and the requirements within, just to see which ones you're interested in and to make sure from an eligibility standpoint. Thanks, Neil.
Mm-hmm. For sure. So I see another one regarding the term team. So can the team represent a coalition of providers across multiple geographic areas? In particular, I think this person was referring to integrated care and paramedic offerings. So absolutely. And again, we would encourage you to look at the sort of eligibility and specifics for each offering on our website. But yes, for example, for the paramedics and social prescribing, we encourage a coalition of providers to apply with a paramedic service as the lead, and they can partner with community organizations that are providing social supports, or they can represent a number of paramedic services working together to improve social prescribing across their services. But yes, I think more generally, for many of the offerings, you're able to partner with other providers within your region or your geography. So there is some flexibility as to how we define a team. I think we want to make sure that where it makes sense, that people are doing things in an aligned fashion, specifically in specific geographies. So, but again, I think the best place to look specifically is at the either attend the Q&A sessions over the next couple of weeks for the different offerings, or look at the actual call for applications on our website.
I'm taking a look at thanks so much for that, Neil. And I've taken a look at the chat. I feel certainly there's some common themes and questions that we've answered. The team at HEC has put a lot of links into the chat, but recognize that there's a lot of links coming in. This will all be part of the message that we do send out with more information. Also included, want to acknowledge there is a central application inbox for any specific individual teams that might have questions about individual team, whether approach, design, or eligibility. So please do not hesitate to reach out to them. But I'm just doing one final look through. I'm not seeing anything, but does not mean that there's not certainly many other opportunities to answer any of your questions. Great question about how are the applications selected, and that. So this also depends on each offering. For the Right Care Challenge, as long as a team meets the eligibility for the challenge, they are in. So this is where it's a low barrier offering. And they will be, and then there's no review process. For the Enhancing Integrated Care, we are aiming for 100 teams. So certainly if we get 100 teams and the teams meet all the requirements for the application, we will go from there. Then certainly if we hit more than 100 teams, certainly there's a lot of, ideally we might even be able to take on some more teams. So certainly do show us your interest on that, and we'll be able to share more as we learn more on that. For the primary care access improvement, it does follow a more traditional review process. So there will be a very diverse and with representatives of across the country that will serve on a review panel of applicants for the primary care access improvement in order to support the selection of the 25 teams. And within the details of the call for application, it will detail out as to what is the criteria that will be used as part of that assessment. Neil, I'll hand it over to you to maybe speak about the paramedic one.
For sure. And yeah, similar to the primary care access improvement offering, the paramedics and social prescribing will also we'll see the applications that come in, and then there will be a review process. And again, more details are outlined in those documents on our website. And I saw, I think it disappeared. It was already answered in the chat, but just to maybe speak to it, for the Right Care Challenge, again, it's a broad offering. So acute care sites, hospitals can also be part of the challenge. Community-based sites, primary care, it's really long-term care. There's lots of opportunities, no matter the care setting, for you to participate in that. So it's quite broad.
Great point, Neil. Absolutely. So especially for the Enhancing Integrated Care and Right Care Challenge, it is really a broad view of settings, as long as the initiative, the work that the team is looking to do is all towards that expanding access to care in order to ease pressures on emergency departments. And just before, I know we jumped away from about what's the selection process for the applications, just highlighting that HEC does look for ensuring we are supporting teams just across all jurisdictions across this country. Wow, what a lot of great, wonderful questions, and certainly shows a lot of interest of what's going on. And I'm sure this conversation might have just even spurred off even more questions and that. So maybe Neil, I'll pass it over to you for the last part.
I'm on mute. Okay, I'll come off mute. Managing multiple screens here. So really appreciate everyone who took the time to share their questions in the chat. And again, lots of opportunities to answer more questions as they come in. There is a frequently asked question document as well, I believe, and there'll be more opportunities in the coming weeks. So we want to emphasize that across all these offerings, there are many ways to get involved in the Pan-Canadian movement, each designed to meet you and your organization where you're at. Your team can choose the offering that best fits your work, structure, and readiness. You can even apply for multiple offerings to build your skills and get more support throughout your improvement journey. Whether you want to move at your own pace or need more guided support, HEC is here to help your team and organization create a bigger impact in your community and beyond. Collectively, we can accelerate paths to better care for everyone. We also know that there was a lot of information shared today across multiple offerings, but not to worry. As Megan, Jen, Bill, and Sarah have mentioned, we'll be hosting a series of Q&A sessions in the coming weeks that are specific to each of the 4 new offerings. And I believe those are visible on the screen as well, so you can see when those are coming up. If you want to learn more or have additional questions, we encourage you to sign up for the ones you're interested in. As well, if you're interested in the awards-based sparking change and the appropriate use of antipsychotics, there's lots of information on our website, including a recording of the informational webinar, which is posted there. If you're interested in participating in Nursing Home Without Walls, please email, just checking here, nope, it's not on here, so I'll just say nhwww-fssm@hec-esc.ca. We'll post that in the chat for you so that if you're interested, you can reach out there. All of this information will also be provided in the recap email, including the recording of the session. So if you missed something, or if you know colleagues that couldn't attend, the recording will be quite useful. So to wrap up today's session, we have a quick poll that we're going to launch in just a second. Your feedback is really important and valuable to us as we design future webinars. So we please ask that you take a moment to provide us with some feedback on today's session. And so please, oh, there you go. You should be seeing a poll on your screen. So we'll just give you a moment or two to go through that. And as people are answering the poll, if you're getting ready to leave the webinar, we do want to extend some warm thank yous to everyone for the excellent and engaging session. We hope you found it informative and will join us in improving health outcomes, care experiences for patients and providers, and the value and equity of care nationwide. I also want to extend thank yous to my co-hosts, Colleen, Bill, Jen, Megan, and Sarah for their excellent overviews today. And of course, we couldn't do this without you. So thank you to all of you for attending and for joining us today. And thank you, of course, to all of our producers and people behind the scenes. So once you fill up that poll, that will be the end for today. So wishing you all a great day, everyone, and have a wonderful Wednesday. Have a great day.